protein is really important for bone health. In fact, 50% of our bone is made up of protein. So women should be mindful of their protein intake and make sure that they are meeting their daily protein requirement as well.
Hi and welcome to another episode of Say Yes to a Healthy Living. And today we will be discussing about something which has been a concern for women, especially who are above 30. I'm talking about bone health. So to discuss this, I have with me Dr. Harsha Joshi, who is the Program Director at INFS. Welcome, Doctor.
Hi Toshi, thank you everyone. I am Dr. Harsha, the Program Director of the Institute of Nutrition and Fitness Sciences.
Hi, Doctor. So, my first question to you would be that, we've always heard that if you're 30 or above and you're a woman, you will definitely start facing deficiency with calcium, and that will, directly affect your bone health. So, what do you have to say on that?
Well, there is, some scientific truth to it, though this is also preventable with the right nutrition and exercise. Women are certainly more vulnerable when it comes to bone issues as compared to men. So, if 1 in 5 men in the senior age group would suffer from bone-related disorders, the proportion for women is much higher. It is as common as 1 in 3 women. So women need to be more cautious when it comes to taking care of their bone health.
So Doctor, now the first, as we discussed about men and women, so is there any difference between the composition of male or the female bones? Could you highlight that?
Yes, there is certainly a difference in the bones in the skeletal framework of men and women. So generally men do tend to have larger surface area for their bones, and the bones, there is more bone at the site where the muscles and ligaments attach to the bones. But when it comes to females, the surface area is not that much. And the other thing is, there is an advantage in the sense women do have a stronger pelvis because obviously, they have to give birth. So that is one thing. But men again have the advantage of a few more years of growth spurts when it comes to their bone growth, which females do not have. So yes, that is the primary difference between the male and the female bones.
Doctor, I would, as I mentioned, my first question to you would be that, above 30, there is a certain stigma that, if you're 30 and plus, you should start taking calcium. So is there any specific age where, women need to start taking care of their bone health or something?
Yes, post 30, women should definitely start taking care of their bones, because after the age of 30, the bone mass, the bone mineral density starts to reduce gradually. And in case of women, this effect will become most pronounced when the ladies are nearing their menopause. So a couple of years before the menopause and post-menopause also, the speed at which the bone mineral density reduces, that starts getting faster. So beginning 30 onwards, I would definitely recommend all women to start taking care of their bones.
Doctor, what can be done, to, if, the bone mass starts to reduce? So what can be done to prevent that, or what measures the women can take?
So there are, a couple of measures that I would like to suggest. The number one is to be mindful that you do not have any deficiencies. So you need to keep a tab on your calcium levels, your vitamin D levels, especially, once you are crossing the age of 35 and significantly so after your menopause. So keep a tab on these mineral deficiencies, because this is what would make you more prone to bone related issues. The second very important thing is to have a weight that falls within the normal stable range, neither too less nor too much, because if the weight is too less for underweight females, the bone mass is going to go on decreasing. It would be lesser. So again, that puts you at a risk for bone issues. And if you happen to be overweight, it's the bone quality that starts to suffer, and you also become more prone to imbalances and falls and fractures. So having a stable weight is another thing which is very important. The third thing is exercise. So exercise, it has been scientifically proven to have the capability of improving your bone mass and your bone mineral density. And it is not just the youngsters that I am talking about, even postmenopausal women, senior women, if they also start exercising, research shows that as little as 30 minutes of exercise in a day can actually improve your bone mineral density. Take care of your minerals, take care and your diet, take care of your weight, and exercise regularly.
So, doctor, as we discussed, you also pointed out about menopause. So, how are these two things interrelated, your bone health and your menopause?
See, basically, what happens in menopause is that certain hormones start dropping in females. So, estrogen, progesterone, these hormones begin to reduce. And these hormones are directly related to the way in which a female's body can absorb important minerals like calcium. So, because the hormones are low, the mineral absorption is low, which makes your bones weaker, the mineral density lesser, and it makes you more prone to disorders like osteoporosis, where your bones can actually become porous. So that is the primary correlation.
Can you just differentiate between what is osteopenia, osteoporosis, and osteoarthritis?
So when we speak of osteopenia, it is not really a disease. It is a decreased bone mineral density, and you don't usually find any clinical sign or symptom of osteopenia. So most often what happens is you're going in for a routine checkup, and it just happens to reflect in your reports that your bone density is going down. But at the same time, it is an alarm, because once you do have osteopenia, it indicates that you are at a greater risk for developing osteoporosis later in your life. And when we speak of osteoporosis, well, it is a disorder that is mainly linked to two things. One is the mineral and vitamin deficiencies, mainly calcium and vitamin D. And the second thing is the hormonal levels, as I mentioned, in menopausal and postmenopausal females. And in this, you lose the bone mineral density and your bones become porous. And when we speak of osteoarthritis, where it is a chronic disease of the joints, it is a degenerative joint disease. So your bones basically have a protective layer, something known as a cartilage, and that goes on decreasing, that goes on degenerating. So you tend to have painful joints, you tend to have swollen joints, you tend to have stiff joints. So that is what osteoarthritis is all about.
Right, doctor, as you mentioned about vitamin D and other minerals that women consume or something. So there are certain supplements also that are recommended to women. So are they really useful in strengthening the bones? What do you have to say about that? Should women consume supplements, or how should they go about it? They should consult a doctor. What is the science behind it?
So, Doshi, instead of going for these over-the-counter multivitamins that are available, I would always suggest women to first get their blood test done. They need to evaluate clinically how is their vitamin D level, how is the calcium, because that is when you will get the adequate dosage. It is not just important to consume minerals and vitamins, it is important to consume them in the adequate dosages. But there are certainly some vitamins and minerals which have proven to be very useful for women. So vitamin D and calcium, we have magnesium and zinc, even vitamin K. So definitely these supplements do help when it comes to improving bone health. And an often neglected fact about bone health, which I would really like to stress upon, is protein. So protein is really important for bone health. In fact, 50% of our bone is made up of protein. So women should be mindful of their protein intake and make sure that they are meeting their daily protein requirement as well.
Doctors, we were discussing about protein and diets. What important things, women should include in their diet on a daily basis so that, their calcium requirement is fulfilled, or other vitamins and minerals are fulfilled, and their bone health is also well maintained.
So basically a holistic diet, which is a good balance of proteins, carbs, and fats, along with the micronutrients. And talking about particular recommendations, I would say milk and cheese, yogurt, green leafy vegetables, consume a lot of those, particularly fenugreek and spinach. Even broccoli is great for vitamin K, and also omega-3 fatty acids. They do support bone health. So would definitely recommend almonds and walnuts, and flax seeds, and fatty fish. And in speaking of seeds, chia seeds and sesame seeds are also quite good when it comes to bone health. And for protein, definitely, for the non-vegetarians, eggs and meat, fish are great options. And for the vegetarians, soya is a wonderful option. So is paneer.
Right, doctor. So, you have to maintain a well-balanced diet, which includes your proteins. For vegetarians, you can go for soya or paneer, as you mentioned. For non-vegetarians, you can go for your preferred source of meat. And then, you should also include certain microgreens and green leafy vegetables. And then, of course, you need to include some sort of supplement which has calcium in it, for like paneer or milk or yogurt or milk for that matter. And also, certain seeds also give that kick. So as we spoke about the diet requirements, what exercises you would recommend, if you could list 5 of them, women who are at home and cannot go to the gym, so what all they can do at just staying at home?
Yes. So strength training, definitely, because strength training has been proven to actually increase the bone mass density. And particularly, if I have to recommend exercise, then exercises that are exerting a push and pull, sort of a force and movement around your joints. So something like squats, which you can easily do at home without using any equipment, or knee push-ups or regular push-ups. Those are also really wonderful. If you gym, then leg press and use weights, that will surely help. Apart from that, yoga is also wonderful for joint health. So Surya Namaskar is one exercise which is very good when it comes to strengthening your joints and improving your overall flexibility. So yes, these are. And if you have something like osteoarthritis, which is limiting your movements, and you cannot do
like
all
who,
this.
like whose bones are not very strong or something, or they're facing with some of the other issue, so how can they practice some exercise? So what movements they can do?
So simply walking also helps. Even 30 minutes of exercise, any exercise. So even if you go for a walk, which will definitely not put too much of a load on your joints, that also helps. So for those who are having restriction because of the painful or stiff joints, try walking, or try light, low impact kind of aerobic exercises, which will not strain your joints.
Right, doctor. So we've discussed about bone health for anyone and everyone, not just women. Even men can follow these certain tips which you shared with us. Thank you so much for taking out time for India.com and the health site. We'll be back with another episode next week. Till then, stay tuned.